Hi ladies, so I want to talk to you a little bit more about exercise, structured exercise. So things where we're setting aside a time in our day or in our week where we're actually going to just dedicate that to some form of structured exercise. So this is aside from what we've already talked about with our NEAT, where we're just doing little bits of extra through the day, our gardening, our DIY, our housework, our playing with the children, stuff like that. This is a dedicated time that we're setting aside for physical activity. Okay, I've already touched on the fact that exercise is not a good strategy for weight loss. Okay, I know that sounds really bizarre, especially coming from a fitness professional. What I mean by that is that on its own, it's not very effective. Okay, diet is by far the more effective part of the equation. Okay, some people think it's 50-50, we've got to diet, we've got to exercise. Some people a little bit more clued up might tell you it's sort of 70-30, 80-20, something like that. I would go so far as to say it's probably around 90% diet, 10% exercise is your equation in terms of fat loss. Okay, the reasons for that, exercise doesn't burn as many calories as you think. Even if you did something that burnt a lot of calories, something like a high intensity workout, or you went for a very, very long run, I'm talking sort of, 10k upwards, you're typically gonna burn between 300 and 600 calories. Okay, that's like one burger, right? It's not a lot. Okay, and the problem is when you've done that exercise, you then come home and you think, oh, I've done a lot of exercise, I'll have that burger. So we get compensatory behaviours. Okay, and this has been well documented in studies. So what we tend to do is either the exercise has increased our hunger, and so then we eat a little bit more, particularly if it's cardiovascular exercise, that can really ramp up your hunger signals, or we compensate by doing less for the rest of the day, or maybe less tomorrow. Okay, maybe we've done quite a vigorous exercise and we're aching a little bit, so the next day actually we've got to take a bit of a day off, maybe our joints are hurting, maybe we've got some muscle aches from the exercise, so we make tomorrow a rest day. Yeah, rest days should always be active, but that isn't what happens. Yeah, we tend to then just be quite sedentary until we feel ready again to go again. So in actual fact, if we'd have just done a normal NEAT for the 2 days, we would get exactly the same calorific deficit and the same body response as doing the exercise one day and then resting the next day. So it's not always effective in that sense. So you've only got to look around. Okay, look at people that are going to gym, going to classes, and I'm sure we all know people, we've got friends or even ourselves, and we've been going to these classes for months and months and months and maybe even years, and we're not any skinnier, we're no slimmer. Okay, what we'll probably find is we've got stronger and we've got fitter, but we haven't necessarily got slimmer. Look at the marathon. Okay, marathon's coming up quite soon actually. Sort of marathon, half marathon seasons. Not the athletes, but look at people that are just, I think I'll have a go at the marathon. And you'll find a lot of them are overweight, and some of them, that's the reason why they thought they'd do it. I'm going to do a marathon, I'll get fit. Think about the training that's gone into that marathon. It's a 26-mile run. Okay, so these guys are doing probably upwards of 10-mile runs every week in preparation for that, and they're still turning up on marathon day overweight. How's that happening? Yeah, what do you need to run to get that weight off then? The fact is, it doesn't get the weight off, that's the problem. Okay, and trust me, I know, I've done 4 half marathons now, and I can show you the photos of me at the finish line, photos of me running those, and I'm still carrying excess weight, even at just 2 or 3 stone overweight. So you would think, well, if I'm running half marathons and I'm running 10 miles every week to train for that 13-mile race, how many 10 miles would I need to get to get rid of even a stone or 2 stone? Surely I would be somewhere close to goal weight if I was only 2 or 3 stone overweight to start with. But it wasn't the case. Okay, so trust me when I tell you it's not a great straight weight loss strategy. That doesn't mean that we shouldn't exercise. Okay, there are myriad of benefits to exercise, just not weight loss. Okay, so I want to talk to you a little bit about the pros and the cons. Okay, and there are some cons, we have to accept that, but definitely the pros outweigh it. So we've talked about compensatory behaviours as being a con potentially. If we look at other subjective reasons why we might not exercise, maybe we can't find the time, so that could be an issue. Maybe we don't have the money, so that doesn't stop you from all types of exercise, but it might stop you from some. So maybe you can't afford a gym membership, maybe you can't afford to go to classes, maybe it's a challenge for you to find money for programs like this one. So that's definitely something to consider. And then there's clothing that goes with it. So although we don't have to have all the latest high-tech gear, we may need to invest in some loose-fitting clothing, some clothing that's breathable, some trainers or soft shoes that are fit for purpose. So that could be a potential hurdle that we need to overcome. There is a risk of injury when we exercise. There's always a risk of injury, and that's why when you sign up to programs like this or you join the gym, you have to fill out forms telling us about your readiness for exercise. Okay, so we have the PARQ that you filled out, which is participation activity readiness form. Okay, so yes, there is risk of injury, and that is heightened if you're exercising on your own without supervision, if you're exercising more than probably you're capable of because you're thinking that's going to get me quicker and better results, or if you have a previous injury or a previous ache or pain or something that could develop or potentially get worse through exercise. And even if it's not injury, it could just be the pain that's there. That pain could increase. You could find new pains, different types of pain. So it could be muscular or joint pain or nerve pain, or it could just be aches from doing the exercise, okay, which is what we call DOMS, which is delayed onset muscle soreness. And that's particularly common when you start a new exercise for the first time. So things like that could put you off. Heart attack is a common thing that I hear. Oh my God, I don't want to have a heart attack. It's quite an old myth now, and it's been dispelled really. Exercise carries a very, very low risk of causing a heart attack in people that are predisposed to that already. So people that already have heart disease, diagnosed or undiagnosed. But it's caused by atherosclerotic plaque dislodging and then causing a blockage. And that's not really any more likely to happen during exercise than at any other time. Okay, so the risks are minimal on having a heart attack while you're exercising. That's the good news. What else? It can cause chronic stress and increase inflammation, particularly for over-exercising. So if you're just starting a new regime and you're getting a little bit all excited and you're like, I'm going to exercise every single day, I'm going to do it without fail, I'm going to do an hour, I'm going to go for it, you could actually create quite a lot of stress in your body that it's not used to. With that stress, your cortisol levels can raise, which is the stress hormone. And when cortisol raises, it can actually increase weight gain, and you may also get increased inflammation through the cortisol and the stress response, but also through muscle repair. So when muscles are damaged, they will become inflamed to some extent, and so that can be an issue if you're already inflamed. What else? Gyms. You may or may not know, I'm not a fan of gyms. I do work in them. I do not work out in them. I don't like them, horrible places. Why don't I like them? I find them claustrophobic. I don't know, they're just... And the biggest issues, I think, when we're talking about pros and cons, some people don't like the fact that they think that other people are watching them, watching what they're doing, and even I feel like that. And it's not even the case, okay? You know, if you go into the gym, you'll find that people are far more obsessed with themselves and what they're doing and worrying about whether everybody's watching them to be worrying about anybody else. But you can get that feeling, and that can be quite intimidating, particularly if you feel like you don't necessarily look the part. So, you know, some people get intimidated by the leaner or more muscly people, whether they're male or female, you know, maybe wearing all the kit and looking really good, taking their little Instagram shots, and we're thinking, oh, I'm not like that person, I'm not them. So that can be quite intimidating. From a health point of view, gyms tend to have quite high levels of EMF, electromagnetic fields, which is actually quite detrimental to your health, and that's caused by all of the electrical equipment that's in the gym. So all the treadmills, the cross trainers, the tellies, the music, the lights, all of those kind of things. So that's actually quite detrimental to your health. It's far better to exercise outdoors if you can, or away from as much electrical interference as possible. They can also be quite a feeding ground for bacteria and germs, depending on how clean your gym is, and especially at the moment that's obviously a heightened concern. So if you are using a gym, use your wipes, use your hand sanitizers. Not everybody unfortunately wipes down the equipment after they've used it, so I would wipe it down before you use it as well as after. And just sort of maintain your distances, particularly if you're in a class setting or a group exercise setting. They should obviously now be enforcing a 2 metre gap anyway, but if they're not, just try and create that gap for yourself. So those are the negatives. Oh my God, who wants to exercise, eh? All of that going against you. So let's talk about the positives. And then there's so many benefits to exercise, okay? So obviously it will help to preserve the lean muscle mass that you've already got, and depending on what type of exercise you do, it may then build more muscle, okay? And there's still a stigma on this, especially for women, where we think, oh, I don't want to build muscle, I don't want to be muscly, okay? And we think we're all going to end up looking like Arnold Schwarzenegger. It's not the case, okay? You need to be seriously dedicated, like spending upwards of 4 hours a day in the gym. Your nutrition needs to be bang on. You need to be eating a lot of protein, probably supplements, to get anywhere near bodybuilder type look, okay? What can happen is you can look a little bit bulkier. If you're building muscle and you're not dropping the body fat, that can make you appear bigger because you'll have the muscle underneath, the fat on top, and that will add then obviously to your size. So that is a watch out on that one. But nobody accidentally got really muscly, okay? It's not going to happen overnight. You're not going to think, oh my God, where did that come from? Okay, I lift very, very heavy weights quite frequently. I don't look like Arnie, okay? Why? Because my nutrition isn't 100% on point. It's good, but it's not great, and it's certainly not excellent, which is what it would need to be really lean and ripped. It's important for us to build muscle. Why? Especially for women. We lose muscle mass as we get older. With loss of muscle mass, we lose strength. Women are more prone to falls as we get older. We're more prone to having to go into care because we can't lift ourselves out of chairs or we can't get up off the floor. So strength is really important, especially as we get older, okay? Having lean muscle mass will also help you to burn the fat. So the more muscle you've got, the more fat you will burn, because muscle takes a lot of energy to maintain. This is why bodybuilders are eating 3 chickens and 10 egg whites a day, because it's hard work to maintain the muscle. Hard work is good. So if we've got that muscle, those calories that we're putting in are going to be used to maintain the muscle, okay, instead of being stored as fat because we're not using them, okay? So more muscle equals less fat as a direct result, okay? Muscle is going to give you the lean, slim look, okay, because muscle takes up less space in your body than the fat does, okay? It's tighter, it's harder, it's firmer, so it's going to give you that lean, toned look, all right? Exercise will help to maximize the fat loss. So if your nutrition is on point and then you're exercising, taking yourself into a calorie deficit, it will help to maximize the fat loss. Exercising tells your body not to take away the muscle, okay? So when you go into a calorie deficit, your body's got to make cuts somewhere. Obviously we're hoping it's going to cut the fat. As I've just told you, muscle takes a lot of energy to maintain. So if your body thinks that you're not using that muscle, that's where it's going to make its cuts from, okay? So we think, well, you know, this is hard work maintaining this muscle. She's not really using it. She only sits in front of the telly every night. So let's get rid of some of that. So what happens is, yes, your number on the scale goes down, but actually you've lost muscle, not fat. So now you're still the same size, but just more fat, less muscle. Your basal metabolic rate, the number of calories you burn at rest, will then drop because you're not using the muscle mass to burn calories, and you'll end up in a worse position than when you started. So exercise is really, really important for maintaining, building our muscle mass. Okay, let's talk about health benefits and reduced risks. So it can help to lower your blood pressure, okay, which is a massive win, okay? So with lowered blood pressure will come a reduced risk of heart disease, a stroke. It will also help to lower and regulate your blood sugars and your insulin levels. We've talked previously on the programme about maintaining nice steady blood sugars and insulin. So with that comes a reduced risk of diabetes, or pre-diabetes or insulin resistance. It will also reduce your risk of certain cancers as well. It will improve your bone strength, particularly if you're doing weight-bearing exercises or exercises where some impact is involved. So, for example, running, jumping, those kind of things. It will improve the bone strength, it will improve the bone density. This is another key factor, particularly for women, particularly as we get older, and particularly post-menopause, okay? As we go through menopause, we start to lose bone density, okay? And that can lead to osteoporosis, okay? Which is, if you imagine your bones being slightly sponge-like, so they've got little tiny, tiny holes in them. Osteoporosis is where those holes start to get bigger, to become a bit more like Swiss cheese, okay? As those holes get bigger, obviously there's less bone mass there then, and that can then be more prone to fracture, okay? So menopause makes this happen to us, unfortunately, and this is why women are more prone to falls, more prone to hip fractures, okay? Hip fractures are a leading reason for being admitted into care, okay? And they're also associated with a higher mortality rate. So we want to keep those bones nice and strong. Weight bearing exercise is key for that, Okay, and that can be resistance, it can be the bands like we're doing in the class, anything where muscles are resisting tension. Okay, so let's talk about pains. So we've talked about how it can heighten pain and how it can make pains worse. It can also reduce pains. Okay, if we get the level and the balance right, it can reduce muscle aches and pains. It can reduce joint stiffness, particularly if we're keeping it quite low key. So walking, swimming, maybe cycling, things like that can help to actually reduce our pains. Exercise releases endorphins in our body. Okay, so that will help with pain reduction as well. Okay, it's like a natural painkiller. And those endorphins will also help to improve your mood, so they'll give you a mood boost, make you feel happier, make you feel better, and they can improve your mental well-being as well. So it will reduce your risk of things like depression and stress-related illnesses. It's great for your brain as well. Okay, exercise is massively important for your brain. Dr. David Perlmutter is a leading expert in Alzheimer's disease, and his single recommendation for reducing your risk of Alzheimer's is to buy a pair of trainers. Okay, so yeah, it's massive. Exercising daily, even just walking, will reduce your risk of dementia, Alzheimer's, so depression, stress. It will improve your cognitive function, it will improve your memory, it will reduce brain fog, and all of those kind of things. Okay, so if you want to feel awake, alert, alive, brain is in focus, then exercise is really good for that. So if you've got tests coming up, exams coming up, something important, an interview, something like that, get some exercise. It's great for boosting your mood and your cognitive function. Sleep. Okay, exercise is brilliant for improving your sleep quantity and quality. So provided that you go to bed at a reasonable time, it will help you to fall asleep easier, and it will help you to get more deep sleep. Okay, deep sleep again is important for reducing stress, for weight gain, weight loss. Okay, so lack of sleep has been correlated with increased weight, so sleep is really important on that, and that's all to do with cortisol responses and things like that as well. Lack of sleep is also associated again with poor cognitive function. We know that, we get a bad night's sleep, we get up and we're like, can't do anything, can't think, can't function, need a coffee. So good sleep helps your brain to function better as well. Okay, so there's all of those benefits. Okay, so reduced risk of heart disease, diabetes, stroke, cancer, improved moods, improved sleep, improved mental health, improved cognitive function, building muscle, building bone density, all the positives of exercising. So don't let those couple of negatives that I gave you at the beginning put you off. But I do want you to start thinking about all of those positives rather than thinking about, I'm going to burn X amount of calories and that's going to give me X number of pounds or kilos in weight loss, because you'll probably be a little bit disappointed on that. And I know a few of you have been disappointed that there isn't more exercise in this program, and that will come. It will develop through the program if you're staying with me for the 12 weeks. But you were probably thinking that the exercise was going to be the key to the weight loss, and it's not. Okay, the diet is the key to the weight loss. All right, so hopefully that's given you a little bit more insight into why we want to exercise, what the benefits are. Throughout the rest of the week, I'll be talking about different types of exercise and the pros and cons of those, which ones might suit you, which ones might not. Okay, so look out for more videos in this series.